Medicare is health insurance administered by the federal government. Medicare Part A, hospital insurance, and Medicare Part B, medical insurance, is known as Original Medicare. These are what you enroll in through the Social Security Administration when eligible. This is a high-level overview of the basics of Medicare. First, we'll go over Original Medicare. Original Medicare has two parts, Part A and Part B. Medicare Part A is hospital insurance and provides coverage for inpatient hospital, skilled nursing facility, hospice, and home health care services. Typically with Part A, there is no monthly premium, as this is something you have paid through employer taxes while working. Under Medicare Part A, there is a $1,736 deductible per hospital admit for 2026, and there is no coinsurance. Medicare Part B helps cover medical services such as outpatient care, office visits, lab and x-ray, and preventive services. There is a monthly premium for Medicare Part B. The base premium amount for 2026 begins at $202.90 and may be adjusted based on your modified adjusted gross income. If you are a higher income earner, you may pay more than the base premium. Medicare determines your Part B premium amount off your reported income from 2 years prior. For example, the base premium for 2026 is set from your 2024 modified adjusted gross income. The annual deductible for 2026 for Original Medicare Part B is $283, and you would be responsible for the 20% coinsurance Medicare covers for Medicare-covered services. If you are receiving a Social Security benefit, Medicare will automatically deduct your Part B premium from your benefit. If you are not receiving a Social Security benefit, they will bill you directly each quarter. As stated in the previous slide, Original Medicare is made up of two parts, Medicare Part A and Part B. Now, if you are only enrolled in Medicare Part A and Part B and nothing else and use medical services, Medicare will pay 80% of Medicare-approved services, and you would be responsible for the remaining 20% that Medicare did not cover. Original Medicare does not include Part D prescription coverage. Because Original Medicare does not pay for all your services, you can purchase plans to supplement those things Original Medicare does not cover. There are two types of supplement plans. We'll first discuss Medigap plans. Medigap plans are purchased to fill in the gaps that Original Medicare doesn't cover. Under a Medigap plan, Medicare pays 80% for Medicare-approved services, and the Medigap plan pays the 20% Medicare doesn't cover. Medigap plans do not include Medicare Part D prescription drug coverage. Benefits are limited to Medicare-approved services. Under a Medigap plan, there is no provider network. You can see any provider that is accepting Medicare assignment. The provider bills Medicare, and Medicare will coordinate with the Medigap plan to pay the 20% of Medicare-approved services. To enroll in a Medigap plan, you must be enrolled and maintain your Medicare Part A and Part B. Premiums paid for your Medigap plan are a separate premium in addition to your Medicare Part B premium. Next, Medicare Part C, or Medicare Advantage, MA plans, are different than a Medigap plan. These plans are purchased separately through private insurance companies and are like plans you may have had while working through an employer-sponsored group plan. Medicare Advantage plans have a variety of designs, such as a Preferred Provider Organization, PPO, and a Health Maintenance Organization, HMO. Under a Medicare Advantage plan, providers bill the insurance company directly. Medicare Advantage plans typically include a Part D prescription drug plan and may include additional services not available under a Medigap plan or Original Medicare, such as hearing or vision benefits. To enroll in a Medicare Advantage plan, you must be enrolled and maintain your Medicare Part A and Part B coverage. Premiums paid for your Medicare Advantage plan are a separate premium in addition to your Medicare Part B premium. Additionally, you can only be enrolled in one Medicare Advantage plan at a time. If you enroll in a new Medicare Advantage plan, your enrollment will terminate any prior Medicare Advantage plan coverage in its entirety. Medicare Part D is your pharmacy benefit and is purchased through private insurance companies that contract with CMS. Prescription drug formularies, benefit designs, including the deductible, copays, and coinsurances, will vary by plan. However, all plans are required to follow Medicare's basic prescription drug benefit design. To achieve the greatest savings while enrolled in a Part D prescription drug plan, it is recommended that you use the pharmacies in the health plan's network. CMS sets the Part D prescription drug catastrophic coverage amount each year, which is $2,100 for 2026. A couple of things to be aware of under the Medicare Part D prescription drug plan. If you do not enroll in a creditable drug program when you are first eligible for Medicare, you may be penalized with the late enrollment penalty. This penalty is applied anytime you do not have creditable drug coverage for more than 63 days. Creditable coverage is any prescription drug coverage that is equitable or better than the national base program determined by Medicare. This penalty amount is set by Medicare and is automatically added to your Part D premium. For more information on what is considered creditable, visit Medicare.gov. If you are a high-income earner, Medicare may impose a Part D income-related monthly adjusted amount, IRMA, if your modified adjusted gross income in 2025 exceeds $212,000 if you are married filing jointly, or $106,000 for all other filing statuses. If you accrue this assessment, Medicare will automatically deduct it from your Social Security benefit. If you are not yet receiving your Social Security benefit, Medicare will bill you quarterly. Like your Medicare Advantage plans, you can only be enrolled in one Part D prescription drug plan at a time. If you enroll in a new Part D prescription drug plan, your enrollment will terminate any prior prescription drug plan coverage in its entirety. In the case of PHIP, enrolling in another Part D prescription drug plan outside of PHIP will terminate your PHIP coverage in its entirety with the possibility of no future enrollment opportunities. To recap what we have covered, you first enroll in Medicare Part A and Part B when eligible. Then you may select a Medigap or Medicare Advantage plan. Together, this makes up your Medicare coverage. PHIP is one of many options to supplement your Medicare coverage. Please note, all PHIP plans include the Medicare Part D prescription drug plan. However, if you purchase a Medigap or Medicare Advantage plan outside of PHIP, you may have to purchase a standalone Part D prescription drug plan. Now let's cover Medicare eligibility. Medicare is health insurance for people who are 65 years of age or older, people who are under age 65 and have been receiving a Social Security disability benefit for more than 24 months, and people who have been diagnosed for end-stage renal disease, or ESRD, or amyotrophic lateral sclerosis, or ALS. You become eligible for Medicare at age 65, regardless of whether you are receiving a Social Security benefit at the time. There are only certain times that you can enroll in your Medicare Part A and Part B. When discussing Medicare enrollment, we will concentrate on those that coincide with PHIP enrollment opportunities. If you are collecting Social Security benefits, Social Security will automatically send you your red, white, and blue Medicare card approximately 3 to 4 months prior to your Medicare eligibility date. Your Medicare eligibility date is the first of the month of your 65th birthday, unless your birthday is on the first of the month. In that case, your Medicare eligibility date is the first of the previous month. For example, if your birthday is July 1st, your Medicare eligibility would be June 1st. If you are receiving Social Security disability benefits, you will become eligible on the first of the 25th month after your Social Security disability benefits begin. In certain circumstances, you may delay enrollment into your Medicare Part B. PHIP recommends you contact your Benefits or Human Resources Department to determine if delaying your Medicare enrollment is a viable option. If you are not collecting Social Security, your enrollment into Medicare is not automatic, and you will need to contact the Social Security Administration as early as 90 days in advance of your Medicare eligibility to apply. You can do this online, by phone, or in person at a Social Security office. As stated in the last slide, in certain circumstances you may delay enrollment into your Medicare Part B. Most people who are still working past their Medicare eligibility, age 65, will delay their Medicare Part B because they are still covered under their active employer-sponsored group coverage. If you delay your Medicare Part B, you will need to enroll in Medicare Part B prior to your active employer-sponsored group coverage ending. You can do that by contacting Social Security about 90 days prior to your active employer-sponsored group coverage ending. Your Medicare Part B effective date will be the first of the month after your active employer-sponsored group coverage ends. This will also be the same date your Medicare supplement plan begins. If you do not enroll in Medicare Part B when you are first eligible, or within a special enrollment period, SEP, you may have to pay a Part B late enrollment penalty. For more information on whether delaying Medicare Part B is right for you, visit Medicare.gov. To recap what we have covered, you first enroll in Medicare Part A and Part B when eligible. Then you may select a Medigap or Medicare Advantage plan. Together, this makes up your Medicare coverage. PHIP is one of many options to supplement your Medicare coverage. Please note, you may have to purchase a separate Medicare Part D prescription drug plan in addition to your Medigap or Medicare Advantage plan outside of PHIP. We have listed the phone numbers and addresses for Medicare and the Social Security Administration for your convenience. Remember, we're here to help. If you have additional questions, please contact PHIP at the phone number here or by visiting PERShealth.com. Thank you for watching.